There are different stages to the migraine attack. It usually starts with a prodromal symptom, which is a warning that the migraine is coming. So you might feel very euphoric or very down in yourself. You might have cravings. You could be constantly yawning. That occurs a couple of hours before the migraine. Then it goes into the aura. A large majority of people here get the aura. That precedes the headache phase of the migraine attack, with a sensitivity to light and sound and smell and nausea and vomiting. And then you go into the recovery and the resolution phases, which can also be a day getting over the attack where you're just not feeling quite yourself. And that would be typical of migraine in adults. So key triggers in my experience of working, again, for so long with migraineurs: skipping meals, not eating regularly. So many adolescents are conscious of their weight and their diet anyway, but skipping breakfast or skipping lunch is a real no-no for migraineurs. You need to be balanced, you need to be routine. Even if it's a slice of toast and a glass of milk, you need to keep your blood sugars raised and keep that diet thing constant. Not eating enough with growth spurts, exercise, dehydration, lack of fluids, going to bed really late, sleeping in too long in the mornings. That also is a key trigger for adults as well as adolescents. I see so many of you are laughing because you all know that this is it. So if you were in the group that don't know, now you know. And actually a lot of our more chronic adolescent migraineurs that come to Beaumont, we would see from 15 and a half up. So we would see from that age group have all been poor sleepers and find it difficult to go to bed and sleep at night, and that was a very dominant trigger factor. Flickering lights, overexcitement, travel, and stress at home or school. So these are all be very common trigger factors for migraine. Is that okay? I'm sure there's loads others. I mean, diet is something that people ask about, specific foods all the time with me. I think that if there's a particular food that every time you eat it, you find you get a migraine, well then eliminate that. I think eliminating groups of foods is not good. Like, some people eliminate all dairy products from their diet or something like that. I don't think that's good, especially at this age group where you're growing and you need all your nutrients and your vitamins and your minerals. So you need to be careful about eliminating foods from your diet, because it's only really a trigger in less than 20% of migraine patients. The majority would be skipping meals, stress, interrupted sleep patterns, the hormonal cycles, menstruation, ovulation, certainly with young girls. They would be more the dominant trigger factors rather than specific food triggers. If you talk to somebody out in the street, they'll talk to you about cheese, chocolate and red wine being the dominant no. And that would be, I kind of think that's maybe a little bit of a myth with migraine. I think very often it can be a combination of triggers, but you can have a specific food, but you'll know every time you eat it then it's a definite migraine trigger. So if you're eliminating chocolate from your diet and you're still getting migraine, well then go back eating the chocolate, because most likely it's not that. So another question: have you ever tried any non-drug treatments for your migraine, such as yoga or reflexology? Acupuncture, biofeedback, these would be non-physio, non-drug. Wow, that's interesting. So only about 30% have. Are you taking any medications for your migraine? Yes or no? So a lot of people are taking medications for the migraine, okay. So just to talk a little bit about the treatments, the majority of patients will start with taking analgesics, mild analgesics for the migraine, then moving up to the combination analgesics. So it's possible that you start with paracetamol and then move up to the likes of Migrelief, which there might be a combination of a painkiller as well as an antiemetic combined in a medication. And also a lot of GPs will prescribe the non-steroidal anti-inflammatory drugs like naproxen or diphenhydramine, and I'm not so sure. I don't actually manage younger than 18 myself when I'm prescribing, but I'm sure a lot of the GPs will use the non-steroidals like naproxen for adolescents. And Audrey touched on this earlier about the vomiting and the gastric status. A lot of migraineurs actually find that their stomach becomes very stagnant during a migraine. So even when they're taking medication to treat their migraine, their stomach is not actually absorbing the medication properly because of the nausea and this gastric status. So something like Motilium is very, very good at aiding gastric absorption of the drug and getting the drug into your bloodstream faster. And one of the key information tools that you can take away today is the earlier you treat the attack, the more effective the drug is in stopping the symptoms of your migraine. So don't wait, and always be prepared and have your medication with you. So if you know your migraine is coming, and so many of you get the aura, so you know it's a migraine, because the aura always precedes the headache phase of the migraine. Have your medication with you and treat it. Now, all the experts will say you should wait for the aura to pass and only treat when the headache phase starts. Now, there are variants to that, but that's the rule of thumb, that you wait for the aura to pass. So, like our young friend who has the aura for about 30 minutes, you should wait, and only when the headache starts, then you should treat with the acute treatments. However, in my experience, loads of migraineurs do treat during the aura and find it beneficial, but some people don't, and then they outrule that this medication doesn't work, like the triptans don't work, when actually it's the way the drug is crossing the blood-brain barrier and it's not getting to the receptor site in time, and therefore it becomes less effective. So that's just something that you should take away and remember. Dr. Lynch touched on the triptans this morning, and they are unlicensed in children, but last week a GP phoned me. He had a 13-and-a-half-year-old who he wanted me to ask Orla Hardiman could he prescribe Zomig for, and she said absolutely yes. So it does depend on the doctor and where the rule is with them and where they're comfortable on prescribing. But certainly Dr. Lynch was very comfortable with the triptan medications himself. They're migraine specific. They work on the serotonin receptor in the brain, which we know is affected during migraine. They're vasoconstrictive, so they narrow blood vessels. So a lot of people who take the triptans find that they get a flush here in the neck or in the chest just for a couple of seconds, and then it passes off. Anybody taking a triptan? Like Migraine or Zomig, Almagran? Yeah, okay, yeah. Provex. And then there's some new ones as well. So there's a good number of you taking them. So again, it's up to the discretion of the GP. And I've just put there about the preventative medications. Usually we would prescribe preventative medication if the attack is very severe and lasting a long number of days, if the acute treatments are not effective, if there's chronic daily headache associated with the migraine. These would be reasons that we would use a preventative medication. But we nearly always go down the lifestyle road first, and the outruling anything sinister, keeping a diary, lifestyle balance, self-help approaches, and then we'd probably look at a preventative then after that, especially for this age group because they're so young. And once you start the preventative, you're talking 6 months to a year being on a preventative every day for that length of time. And these drugs have side effects. Anybody on a preventative, a daily tablet for migraine? Okay, so a number of you are on it. So again, they have side effects, whether it be weight gain, weight loss, racing dreams, dry mouth. There's so many different side effects. Gastric upset, lots of different side effects. But once you start on them, you need to be on them for a long period of time. So have you ever missed school because of a migraine attack? Yes or no? Wow, 94%, that's huge. If it becomes a regular absence from school, that becomes very disabling for the adolescents. And it becomes a source of family stress. And parents need a lot of reassurance. And even just a simple thing like keeping yourself hydrated. For those of you that are lucky enough to have a school nurse in the facility, that you can go and take your painkiller and maybe lie down in a first aid room or something for a short period of time. And it's probably enough then for you to go back to your studies, and the attack should be of shorter duration. Not letting migraine control your life and not letting the headache control your life is really important. And I hear Orla Hardiman saying that over and over, especially to the adolescents that attend our clinic. And Dr. Rutledge would say the same thing. Regular sleep, regular diet, getting up and dressed at the normal time and keeping yourself balanced and routined, getting on with your homework, limiting time on the computer and the glare from the screens or these Nintendos or Xboxes and the Wii and all the rest, limiting time on things like that can also help. And continuing with your sports and your hobbies. So many of you had said that you missed that due to your migraine. Trying to continue with your routines and your balance of life and hobbies and interests that you possibly can. Because when the adolescents would attend us, and you're talking about getting headache for maybe 30 days out of a month, maybe with migraine occurring twice in those 30 days, and then this dull, nagging headache that can stop you from going to school and stop your productivity at school and concentrating on your lessons and on your exams, because it is quite intense when you're at that school period, especially if you're sitting your leaving cert or your junior cert. So, trying to get on with your life is sometimes difficult, and, that's when look for help when you need it and go the appropriate roads. Go ask the Migraine Association who's the appropriate people in your area, whether it be GP level or neurologist level. And my advice to you, I've worked with so many neurologists, is find the one that's interested in headache and that takes headache seriously. They're the ones to go and see and help manage your attacks. Is that okay? That's me.